So what we know so far is that side effect profiles of these CGRP drugs are terrific. In one of the cases, we have one that maybe causes a little trouble a small percentage of the time, not a huge healthcare risk, just a nuisance. And in most people, that gets better over time or can be treated. So overall, no serious worries about long-term complications. It's not a cardiovascular problem, it's not a bone health problem, etc. All of which we're used to dealing with other drugs that we've used for years. So right now, the situation is really good, and there are no major signals of problems hiding in the background. So that says that we should be able to prescribe these routinely for just about everybody without having to worry about what will happen in 5 or 10 years. Data will continue to be collected. There may be changes in that. You never know for sure, but there's really been nothing to raise any serious concerns so far. The other part of that is the things that we have already been using and will continue to use for acute care. So some combination of triptans and NSAIDs and maybe dopamine blocking antiemetics, all great drugs, but not things that you want to be using every day or 4 or 5 days a week. So now we have the ability to say, here's a package that will reduce the frequency of attacks, reduce your need for these other drugs, which work, but you need to be careful about how much you use them, and you won't have to as much. That's a terrific deal. That's saying you can use the right drugs when you need them, and we can limit how often that comes up because we have treatments that will make it less necessary. That's a great deal.